Vanakkam. Imagine if someone has said something about 3000 years ago that is very relevant and contemporary, and that too about a field that is advancing day by day, the field of medicine. I am talking about the Thirukkural written by the saint poet Thiruvallur. He has laid down the guidelines of how to manage a patient, and he has also laid down the guidelines of how a patient, how a doctor, and how the assistant should behave. And all this said 3000 years ago. So what is it that he has said? We shall see in this video. The first Thirukkural on this subject reads as follows: Noi nadi, noi mudal nadi, adu tanikkum vai nadi, vaipach cheyal. Noi nadi refers to find out what the disease is. Noi means disease, nadi is search for. So first search for the disease that is the problem. Noi mudal nadi. Noi mudal refers to the source of the disease, and of course nadi means to search. So then search for the source of the disease. Then comes adu tanikkum vai nadi. What is the treatment? Search for the treatment of that disease. Vaipach cheyal, and then act or treat the disease according to the situation, according to the opportunities presented. Now this is very important. It is very relevant and contemporary because you may find what the problem is, you may find the cause of the problem, and you may have certain treatment modalities in your armamentarium. But it is very important to suit the treatment according to time and person. That is, the treatment must be customized for that particular patient with that problem, and this treatment that has been decided for the patient must be carried out at the opportune time. Let us see an example to understand what this means. I shall take an example from a problem in the hand. Now just see this patient who has obviously got a flexor tendon injury on the right hand index and middle fingers. So the problem here is the loss of flexor tendons, so he is not able to use the right hand. That is the disease process. The second is the cause. The cause of this problem is a trauma that had occurred 2 years ago, for which he has not sought any treatment. Now, we need to understand that this is not a recurring problem, but the sequelae of the disease or the injury that had occurred have persisted. The third is the treatment of this problem. There are many treatment options available, like flexor tendon grafting, which could be in a single stage, or a multi-stage flexor tendon grafting, or even procedures like the Panva-Holwich procedure. But for this patient, it would be ideal to do a flexor tendon grafting in a staged manner because the skin does not appear very healthy. And finally, the Vaipach cheyal that we talked about, when to carry out this treatment. It is very important that all the joints are soft and supple before we think of carrying out the treatment that we have planned for this patient. So, all the four modalities, that is Noi nadi, Noi mudal nadi, adu tanikkum vai nadi, vaipach cheyal, is very apt for every single condition in the human body, and I have just taken a single example in hand surgery. Well, it is all very nice to say plan the treatment and get the treatment together, but how do we get it all together? How do we assemble this treatment? What are the components of the treatment that we are going to give? Thiruvallur in his Thirukkural also elucidates this and talks about the different components that are going to be involved in the treatment process and also defines each of them. உற்றவன் தீர்ப்பான் மருந்து உழைச்செல்வான் என்று அப்பால் நாற்கூற்றே மருந்து. The word உற்றவன் refers to the person who has been affected by the problem or disease, that is the patient. தீர்ப்பான் is the person who is going to put an end to this problem, that is the doctor. மருந்து is the treatment that is going to be provided. உழைச்செல்வான் refers to the assistant, the person who is going to help in the delivery of this treatment process from the doctor to the patient. அப்பால் நாற்கூற்றே மருந்து refers to the four important components of the treatment process. Summarizing, the four components of any treatment process according to Thiruvallur are உற்றவன் தீர்ப்பான் மருந்து உழைச்செல்வான், that is the patient who is the most important component, the doctor, the treatment process, either the surgery or the drug that is going to be delivered, and the assistant who is going to help in this process. Okay, now that seems quite easy to understand. You need these four components to provide a good treatment. But what if one of these components, like for instance, say the doctor is not experienced, or the assistant is not helping properly, or the patient is non-compliant and does not take the drugs that the doctor prescribes? How would this treatment work? Definitely it would not work. To clarify this, another scholar by the name of Parimel Alagar, who lived in around the 15th century, has said in his interpretation of the Thirukkural that Thiruvallur had stated Appal Narkootre Marundu, which means that the four components that he has described, each has got four characteristics that should be adhered to. This can be seen in the Parimel Alagar Urai or Parimel Alagar's explanation of the Thirukkural. According to Parimel Alagar, the characteristics of the உற்றவன், that is the patient, are பொருளுடைமை, மருத்துவன் வழி நிற்றல், நோய்நிலை உணர்த்தல் வன்மை, மருந்து துன்பம் பொறுத்தல். These are the four characteristics that the patient should have. It means that the patient should be capable of paying. Second, he should follow the doctor's advice. Third, should report all his problems without hiding any of the symptoms. And lastly, should bear the inconveniences that the treatment may give. All of them seem quite relevant except the payment, which I am not able to understand. Perhaps they had some sort of insurance scheme in those days and the patients could pay. When describing the characteristics of the doctor who is treating the patient, Parimel Alagar has defined four characteristics. நோய் கண்டு அஞ்சாமை, ஆசிரியனை வழிபட்டு எய்திய கல்வியும் நுண்ணறிவும் உடைமை, பலகாலும் தீர்த்து வருதல், மனமொழி மெய்கள் தூயவாதல். That is, the doctor should not be scared of the disease. He should treat the patient having learnt from teachers and developed skills. He should have also learnt from experience, and the mind and communication to the patient should be pure and true. As far as the medicine or மருந்து is concerned, it should have the following four characteristics. பல பிணிகட்கும் ஏற்றல், சுவை வீரியம் விளைவாற்றல்களான் மேம்படுதல், எளிதில் எய்தப்படுதல், பகுதியோடு பொருத்துதல். Now that's very interesting. The medicine that is going to be given should be apt for many conditions, should be free from deleterious side effects, should be easy to take, and should be customized for the patient. I would like to try applying this interpretation to surgical procedure also. It does fit well. The surgery should be a simple procedure. It should not harm the other parts of the body. It should be easy to perform and it should be customized for every single patient. And what characteristics should the assistant or the Uழைச்செல்வான் possess? அன்புடைமை, மனமொழி மெய்கள் தூயவாதல், சொல்லியன அவ்வாறே செய்தல் வன்மை, அறிவுடைமை. So the assistant, who may be a nurse, a technician or a therapist, should have the following qualities. He should be caring and concerned. The mind and the communication should be pure and true. He should carry out instructions perfectly and he should be knowledgeable. So, what have we learned from the Thirukkural today? நோய் நாடி, நோய் முதல் நாடி, அது தணிக்கும் வாய் நாடி, வாய்ப்பச் செயல். When a patient presents with a disease or a problem, first we need to find out what is the problem that is affecting the patient. Second, we need to find out the cause of that problem. The third is we need to find the solution to that problem. And lastly, we should plan the treatment for that patient taking into consideration various factors and treat at the opportune moment. We have also learned that any treatment process is going to have four components: the patient, the doctor, the treatment or the procedure, and the assistant who is going to help us in carrying out this treatment, and all the four components should work in unison with correct individual characteristics for the betterment of the patient. In other words, உற்றவன் தீர்ப்பான் மருந்து உழைச்செல்வான் என்று அப்பால் நாற்கூற்றே மருந்து. I hope you enjoyed the video. I enjoyed making it. Please click on the shown links to see other Thirukkurals and their explanation and their relevance to modern day surgical practice. And do not forget to subscribe to stay connected with the latest in learning hand surgery, plastic surgery and trauma surgery. Vanakkam.